Dienogest tablet by Koi Pharmaceuticals Pvt Ltd. It contains Dienogest, 2 mg. Introduction. Dienogest tablet is used for the treatment of pelvic pain associated with endometriosis. It consists of progestin, which is similar to the female hormone and works by suppressing the production of hormone causing endometrium. Dienogest tablet can be taken with or without food, but take it at the same time to get the most benefit. It should be taken as your doctor's advice. The dose and how often you take it depends on what you are taking it for. Your doctor will decide how much you need to improve your symptoms. Swallow the tablets whole with a drink of water. You should take this medicine for as long as it is prescribed for you. Keep taking this medicine even during your menstrual periods. The most common side effects of this medicine include acne, headache, depressed mood, and breast discomfort. If these bother you or appear serious, let your doctor know. There may be ways of reducing or preventing them. Usually, it makes your menstrual cycle irregular or you experience spotting or brown discharge in the middle of cycle. Consult with your doctor if this occurs frequently. Before taking this medicine, let your doctor know if you have ever had unexplained vaginal or uterine bleeding, or have circulatory blood disorder. Your doctor should also know about all other medicines you are taking, as many of these may make this medicine less effective or change the way it works. Tell your doctor if you are pregnant, planning pregnancy or breastfeeding before starting the treatment. Uses of Dienogest tablet. Endometriosis. Side effects of Dienogest tablet. Most side effects do not require any medical attention and disappear as your body adjusts to the medicine. Consult your doctor if they persist or if you're worried about them. Common side effects of Dienogest. Acne. Headache. Depression. Breast discomfort. How to use Dienogest tablet. Take this medicine in the dose and duration as advised by your doctor. Swallow it as a whole. Do not chew, crush or break it. Dienogest tablet may be taken with or without food, but it is better to take it at a fixed time. How Dienogest tablet works. Dienogest tablet is a progestin, female hormone. It works by suppressing the production of estradiol, a hormone that causes excessive growth of the endometrium. Safety advice. Alcohol. Consult your doctor. It is not known whether it is safe to consume alcohol with Dienogest tablet. Please consult your doctor. Pregnancy. Unsafe. Dienogest tablet is highly unsafe to use during pregnancy. Seek your doctor's advice, as studies on pregnant women and animals have shown significant harmful effects to the developing baby. Breastfeeding. Consult your doctor. Dienogest tablet is probably unsafe to use during breastfeeding. Limited human data suggests that the drug may pass into the breast milk and harm the baby. Non-hormonal and progestin-only contraceptives are preferred in breastfeeding women, especially during the first 4 weeks postpartum. Driving. Safe. Dienogest tablet does not usually affect your ability to drive. Kidney. Consult your doctor. There is limited information available on the use of Dienogest tablet in patients with kidney disease. Please consult your doctor. Liver. Caution. Dienogest tablet should be used with caution in patients with liver disease. Dose adjustment of Dienogest tablet may be needed. Please consult your doctor.